everybody, I'm here today with a friend of mine, renowned spine surgeon, Dr. Choll Kim. We recently did a video talking about some stretches that can help golfers if you've got back pain. But heaven forbid the stretches don't work anymore. Wanted to kind of talk about what those next steps look like. So we're not going to try to diagnose you on YouTube or Instagram, but I thought maybe it's a good time to come in and see the doctor. So would you recommend that?
Yes. If after you try exercising, doing the stretches for a little while, if things aren't getting better, it's worthwhile to go see a professional.
Okay.
Probably your primary care doctor who can do an assessment of your symptoms and decide if you need x-rays and MRI and when you need to see a specialist.
Yes. What would be the difference between an x-ray and an MRI?
Okay, the x-ray gives you an idea of what your overall spine looks like in three-dimensional space. And a quick example is you can get an x-ray standing up, whereas almost all MRIs are done lying down.
Okay.
So that's why I'll often want both the x-ray and the MRI. One standing, the other one's lying down.
Okay.
The x-ray, you can also get dynamic views where you lean forward and lean back. They're called flex extension views. And that gives us an idea of how stable your spine is. The MRI looks at static things, and it's really good at looking at nerves and discs and soft tissues. Okay. So it's two complementary studies, and if you go see a spine surgeon, it's very likely that you need both x-rays and an MRI.
Now, as a golfer and an athlete, one thing that just scares me is thinking about surgery. That takes me off the course. So you mentioned in our last video that a lot of symptoms or problems, people actually don't need surgery. So what would be some of the non-operative treatments that we could do for that?
I'm glad you brought that up.
Yes.
The majority of people that I see in my office do not need surgery. I actually spend more time doing non-operative treatment, and it usually starts out with fine-tuning your exercise regimen. And I think we talked about this before.
Right.
The idea is that the muscles that surround your spine, your neck and your thoracic spine and your lumbar spine, are essentially the world's greatest back brace. So the most common thing I notice is that the exercise that you try to do on your own, or even previous PT sessions that you've done, aren't exactly right in terms of optimizing your muscle function. There's a lot of massage and DP and ultrasound in an effort to decrease pain, which is important, obviously, because I'm not a total masochist. But pain is important from the perspective of function. Because most people will do something until it's uncomfortable and then they'll stop. So if you said, I have zero pain but I don't do anything, that's a problem. You want to have function. So it's almost always about fine-tuning the exercise program and making it customized for you. Because there's not one exercise program that works for everybody. The patient, together with their physical therapist, their trainer, and me, are working as a team to basically find that perfect, customized program that's perfect for that patient. Because it'll be different for everybody.
And is the goal then to strengthen the muscles and take care of that, right? Or is it to lengthen discs? Or I'm unfamiliar with all the spine.
I'm glad you brought that up.
Okay.
Because a lot of people ask me, a bulging disc. So if I exercise, will the bulging disc get better? Not really. It's really about your body compensating for all these abnormalities that occur. So just because you have a herniated disc or a bulging disc doesn't mean you're going to have pain, believe it or not.
Really? Does it mean you're going to need surgery?
No.
Okay.
In fact, most people have weird-looking MRIs of their spine, and they don't even know it. So you can't just look at the MRI and think you're going to have a problem because there's a sea of people walking around with abnormal MRIs and they don't even know it. And that's because the MRI is not like a perfect test of pain and function. It just looks at things anatomically, and it does not know the difference between a normal kind of age-related change of the disc versus a pathologic inflamed disc. That requires a little bit of medical detective work. Okay,
so we're saying over time with a specific regimen that's designed for you, would you throw anything else in, like chiropractic work or massage therapy?
Yes.
Or acupuncture?
Yes, yes, and yes.
Right, okay.
Because I'm a big believer in multimodal therapy. In other words, surgery is really boring. You come in, I render you unconscious, and we do surgery and you wake up. Non-operative treatment is exactly the opposite. It's multiple things that you have to coordinate. So in addition to PT, I really like trying chiropractic care, acupuncture, meditation, yoga, and trying a variety of things. And for some people, chiropractic care will be great. Other people, it will be worse. And you can say the same thing about acupuncture, biofeedback, yoga, felt in Christ. There's a whole host of programs that it's sort of like, what's your favorite food? It depends on your mood and you as a
what's
person.
working though, right? Because perhaps you're going down one avenue. How long would you recommend giving it until it's not working?
That's a great question. You can usually tell within 2 or 3 weeks. So if you're doing a program and within 2 or 3 weeks you're not noticing like a significant change in your symptoms, you should be constantly fine-tuning. You could even get that down to less than a week, where week by week you're assessing what you're doing and seeing if it's making an improvement. And if not, you're kind of modifying, fine-tuning, adjusting, optimizing, customizing. You can see how complicated this can be.
One of my questions would be, would you recommend taking, medication to dull the pain so it allows you to be more flexible in, say, yoga, or the other things don't hurt as much? Are we pushing the limits there, or?
It depends. So that's a yes and no question.
Okay.
Because it is 2019. I'm not a big believer in throwing medicines at everything.
Okay.
But there's a reason why we have medicines, and they work. But you have to keep in mind, every time you do something, there's a risk. So the most powerful pain relievers are horribly addictive.
Right.
And right now, people are just deathly afraid of opiates, including me, because I deal with a lot of high-level pain right after surgery. But every once in a while, you do want to use medicines to basically kind of give your body a chance to get better on its own. That's what injections do. That's what chiropractic care does. Anything that helps your body get better on its own without surgery is a worthwhile treatment strategy. But I think people can tell the difference between a good pain and a bad pain. If I go like this and stretch, that kind of hurts, but in a good way.
Right, okay.
If somebody comes over and pushes my knee back, I'm like, whoa, that's a bad pain. So it's not perfect, but that's probably the best, because if you don't push yourself just a little bit during this kind of rehab, you probably won't progress as fast as you need to.
Is there anything else that we should know if we're coming in from a perspective of trying to avoid surgery?
Yes. So let me back up. The 2 things that you can do is find a really good advocate for your healthcare, like a wingman. It could be your significant other. It could be your primary care doctor. It could be a friend that is in the healthcare field.
Okay.
Because let's face it, even Tiger Woods has a coach. So when you get sick and you have problems, don't be shy to ask your friends to help you. Okay. Because in today's day and age, with all the information that we have and all the varying kind of opinions about how to take care of your spine, it's worthwhile kind of vetting things out. So find a good wing person, find a good primary care doctor that you can work with, bring that person with you to all the appointments, have lists of questions, and do due diligence. That's probably the most important thing in terms of doing non-operative treatment.
Okay, and say for a golfer, if we've decided to take the non-operative route, is there a period of time that we should stay away from activities like golf or sports while we heal, or should we just push through?
It depends. I don't believe in pushing through if you're having kind of this bad pain. So if you're having this bad pain, you need to back off. But again, it's different for everybody. So you want to push it a little bit, but not so much. And that's why you kind of need somebody to give you objective feedback. One thing you can do if you have a hard time finding a wing person is keeping a diary of your activities. Today I went to the driving range and then I did 50 push-ups and a bunch of pull-ups.
And now I can't walk.
Yeah, not tonight. Yeah, I can't move. Because sometimes if you overdo it, you won't know for 2 or 3 days. Sort of like if you exercise really hard, your muscles don't get sore for 2 or 3 days, and then it lasts for like a week. Okay. That's the inflammatory process. So this is one of the biggest reasons why people get confused. They'll start doing something, and for apparently no reason, they'll have a bad flare-up. But if you just kind of went back a few days and asked, okay, what's been going on? I bet you most people will find out. Maybe that trip to Disneyland 3 days ago wasn't such a good idea. Because you may not notice until 3 days later. Right. So there's a lot of organization, keeping track and being like this, I don't know, detective person.
Now you mentioned flare-up. Do you recommend the use of ice or heat, or does that not even apply to a spine?
No, I love ice and heat. So heat is really good if the muscles are tight and spasming. Okay. And ice is really good if it's inflamed. So if you play golf all day long and you overdid it, that's going to be an inflammatory process. You may want to put some ice. Okay. And then when you wake up in the morning, you're like, I'm going to be fine in about 5 minutes once I can bend. Okay. That's the heat thing, because when you first wake up in the morning, your muscles are really tight and waking up and warming up. So, and then sometimes I tell people, try either one and see which one makes you feel better.
Okay.
So there's a lot of kind of
Lifestyle.
everyday common sense pragmatism involved.
Got it. Okay. So Dr. Kim, thank you so much for having us here today. We hope you got something out of this video, and if you've got any back pain and exercise isn't working, the doctor might be your next step. Thanks so much for watching.
Thanks for having me. Good luck, everyone.